Hello, good afternoon, everyone. I'm writer Coach Tony, and welcome back to my channel. This is a personal video. I've wanted to do this for a long time. As you very well know, last July I was hospitalized in lung center because I had this bout with um, diarrhea. No? So I did not go to the hospital. I got to the doctor to have it solved. So I ended up in the hospital for 11 days at the lung center. I'm doing this video because I'd like to personally thank the nurses and the doctor who helped me. So when I entered the lung center, there were many patients in the ER when we came at Sunday midnight. So I think I waited, they said I waited for 2 days, but I didn't really notice it because I was already very weak. So when I woke up, I was already in the ICU, and I said, "Wow, what a beautiful room!" And then they said, "Oh, this is ICU." I was like, "Oh my God, why am I in the ICU?" So anyway, it kind of made me panic. But anyway, it turned out that they placed me in the ICU because they wanted to check on me, and there are many quirks inside the lung center, and in terms of how the nurses are. Actually, the nurses are very good. There, most of them are not young anymore, like maybe 30s, 40s, and they're very experienced. They're like your mini mothers. So every day you're assigned to a new nurse. So when I was new there, I was a bit confused because every day there'd be a new person checking my because when you're admitted right now, I noticed your whole body is connected to the machine. So there are so many tubes in your body going out. So it's so hard to move. I cannot even put a pillow because I'm afraid the pillow might hit all these wires, and it will affect my BP, my breathing apparatus. So I was connected everything, my nose, my um, my chest was had like 7 probes, so everything was connected to these machines. So if you watch the current hospital movies in the US, it's similar here in the Philippines. You already have the technology as well. Also, I had to be careful with my suero because I'm afraid that matanggal siya. Natanggal nga talaga siya because the nurse had to change it, and yeah, it wasn't a pleasant experience to have it be attached. But since my hand was already bleeding, I panicked. So anyway, so there's a new nurse every day, and she checks on you. And believe ako kasi I don't know how they remember what medicines to give you because it can be very confusing because you have so many patients, and then they really have to check that they're giving me the correct medicine. And fortunately, none of them made mistakes. They're all very competent, and they're all very nice. They really talk to you, um, which is good for me because I don't want to be just the patient. I want to have at least get to know these people who are actually helping you every day. And with the nurses, they do check on you, your temperature, and to see that you're comfortable, no? Which is very good. Yun lang, I realize you cannot make utos to them, no? Because they're not supposed to do certain things. And I only learned about that as the days progressed, no? Because I noticed there was a hierarchy of people, of duties. Um, so based on their uniform, their duty is to clean you or get your urine. It was a bit difficult for me because especially with the because I had LBM, no? So I had diarrhea. So I had no control over my bowel movement. It was disgusting. It's the first time I slept with, uh, with my diaper full of, But I had no choice because I realized you cannot. They're not at your beck and call. These people who clean these guys. So mainly these are guys, and they do clean you, and they're very good at what they do. They're not crazy. They don't even show, like smell or anything. They're just very professional, and and I admire them for that. And I'm really touched that they did all the cleaning. Because ako nga mismo na I'm disgusted by it. It's my own body. And when I went out of the hospital, it was the first thing I really bought. I bought this Dr. Wong's soap and really had to wash myself because that's a part of my body which was not very clean, no? So I really had to do something about it, just to make sure I don't get, any diseases down there. But fortunately, the doctor also prescribed some medicine plus the cleaning I did, so it was all okay. Eventually, my diarrhea disappeared, and now I'm back to my normal. However, the guys who cleaned, I really owe them a lot. They're amazing, no? And every day changes, but hindi sila maarte. There's also a manong at night who monitors my sleep. And then one night, this manong, he realized I had sleep apnea, so he was so scared because I wasn't breathing. That was like, and I was like, you know, sleep apnea, and he was so, he freaked out because he thought I was dying. But I said, that's really how I sleep, so do not be shocked anymore. What are the tips the nurses gave me? Number one, they told me to um, have a checkup immediately. If I feel something bad, they told me na wag na maghintay kasi nga what happened now in that last visit to the hospital. I waited the last day, and I was so weak already that I had to be hospitalized. They said I should prioritize my health because I'm the breadwinner, and if something happens to me, it's going to be very difficult for my family. So I realize that now. So now, if I do feel something in my body, I'll immediately do something about it. Number two, um, hmm, what else did they teach me? They just allowed me to be me, no, because um, I also did yoga because I was, you know, you were in bed and you didn't do anything. So I did like yoga exercises and things which would make my body a bit stronger. So I did um, stretches, and they were very nice about it. They do warn me about using the cell phone, but I did have to use a cell phone because that was the only way I could contact Laura, no, and ask her to do stuff for me for the next day. Um, yeah, basically the nurses were very good. Um, I was pricked like maybe 14 times. So if you look at my fingers that time, it was all pasa already. But that was part of the cure because they were really looking for the reason why I got sick. Actually, all I had all the tests. Now they did two echo, they did ultrasound, they did X-ray, they did like a CT scan, I think. Because I went through this machine, then I came out, and and then of course my X-ray. And what was nice was they did not find anything abnormal. They did ask me to do this test, but yeah, I think it's negative because they did not come back anymore. And I was cured. No, my lips were cured, and I was able to bounce back. And yeah, I was able to eventually become strong. However, there was a slight glitch because one of the medicines I was taking was causing me not to eat. So that was my second um, big problem because I wasn't eating anymore, no, for 2 weeks. I just eat like one spoon of food, which was very scary. So what I did, I stopped taking the medicine because it was affecting my eating, and it took maybe 1 or 2 weeks before I was able to eat properly again. I'm eating properly now, so I'm becoming more fat. But um, I had to stop that antibiotic because it wasn't helping my food. No? 'Cause if I don't eat, then that would be a big problem. It would make me much weaker. So anyway, I stopped that medicine, and yeah, I did become strong. So that part I was able to solve. Right now, my only concern is I'm not still very strong. My feet still wobble. So that's one thing I have to, make stronger. Um, yeah. So in a way, um, the people in the lung center, the nurses, the orderlies, the guys, the janitors, they were all a big help. And especially to my doctor, I didn't get his name, but he did listen to my concerns, and he was able to solve the problem immediately. I also realized that he also had to check my antibiotics because I found out that I was already resistant to many antibiotics. So that he said that it's difficult to cure me because I had to find antibiotics which should be okay for me. And since he's a smart doctor, was able to find them. No, thank God. So I turned out okay. Um, I do want to go back to my previous life, no, like go to mass and then exercise. Um, but it will take time. I have to observe my body. I don't want to fall kasi that's my concern. Um, so for now, those are the challenges I have personally, which I have to address. And since already it's almost mid-month of August, I have to do something about it so I can continue with my life. Um, I'd like to do a shout out to all the nurses who helped me at the lung center, to the doctor, and to all the support staff who were there every day, the manongs who clean me, the manongs who get my urine. Because every time you have to piss in this thing, no? It's like a picture, and you have to shoot it properly. And there were like 1 or 2 cases that I wasn't able to shoot properly, so the bed becomes wet. And there are also nice people there. There are people there who change your clothes. So sometimes, one time this lady came in and she said, "Oh God, you look so filthy with my clothes and everything." So she did change everything, all the because they have to change pala the bed sheets every 2 days. And I had this parang underneath my butt. They had this parang carpet which I had to buy myself para hindi madumi yung, when I did my waist. Para hindi siya mag-spill. So it was an icky situation, but I had to endure it because, and at least I was in a very clean. Every time I'm cleaned, I'm so happy. And there were like 1 or 2 orderlies who really made sure I was clean. So thank you to them for making the effort. I know they're very tired. I talked to them and they said they have no lunch break, or if they really want to sit, they can't even sit because they have to rush here and there. And I just told them, I hope you'll find the time. Okay, 15 minutes lang nakaupo. Para makakain naman kayo kasi it is impossible for you to do your work. The work of the nurses are very physical. It's very physical. I don't think I can even do that, no? Because it's day in, day out for 8 to 10 hours. And they even laugh about it because apparently they have to do overtime, and sometimes this overtime is not even counted. So it's really a labor of love. What they're doing is a labor of love. And by staying in the Philippines, they're really helping our nation. No? I did ask them why they didn't go out. Most of them just said they're happy here already. And yeah, anyway, Lung Center is a government hospital, so I do hope they get above average. What do you call that? Yung parang retirement pay because they really deserve it. Um, so I'm happy that I went to the lung center because at least I survived, and I had experienced doctors, I had experienced nurses who took care of me, and I'm very grateful that they were able to help me. So I hope this video, some of them chance upon this video, so I unfortunately wasn't able to get their names each one, but the Lord knows you, God knows you. I hope He'll continue to bless you to be of help to many other patients, no? Because the Lung Center has so many patients, so many sick people right now. So with that, I hope you enjoyed my personal sharing about my experience at the Lung Center, especially with the nurses and the doctors there. They're highly qualified and very good. Please subscribe to my channel, Writer Coach Tony, and please follow me on my Twitter, my Instagram, and my Facebook. Bye, everyone.